Palliative Pros, home of the RespRelief Manual Suction Pump Field Kit, developed for field nurses by a field nurse, when patients can't wait. Remember, always observe universal precautions when performing all oral suctioning interventions. The RespRelief is a same patient use medical device. Do not use on more than one patient, but it's a beautiful state-of-the-art device. It weighs about half a pound and is slightly smaller than a Foley catheter kit. Now let's see what's inside and how it's packaged. Read the user instructions and become hands-on familiar with a RespRelief pump before use. For demonstration purposes, we have one already unpacked. Save this zip bag for later disposal of the unit. Inside there is a pump, a 300 milliliter collection jar with cap. Replacement canister kits are available for purchase. A Yanker suction tube without a control valve. A 19-inch connection tubing for Yanker. Adaptation for 19-inch connection tube to Yanker. Also a 14 French suction catheter without a control valve. Then there's a 13 and 6 millimeter rigid suction tubing. Universal French catheter adapter. And it's nice, it fits all size French catheters. So here we have all the items in the box. Now let's put this device together. It's a simple snap assembly. Snap 1, canister to pump. Snap 2, adapter and tube to canister. And now you are field nurse ready. How easy is that? Next, let's perform the basic pump functional test before each use and following cleaning and reassembly for reuse. Check the stroke adjustable lever on the back of the pump for the correct setting of pressure. 100% for adults, 50% for pediatrics. Okay. Next, mount a collection jar with cap to the pump. Obstruct the connection port with your gloved thumb or palm and squeeze the handle several times to check for the vacuum. Additionally, attachment of a suction tube and flush or prime with water ensures vacuumability. By pulling back the handle in a squeezing motion, you allow the squeeze to have the fluid draw from the patient's airway. And before you put it into the airway, clear any obvious foreign substances by using a mouth swab. We will be using raw eggs and blue water for demonstration purposes of just how powerful this RespRelief performs with efficacy. Hold the pump with your non-dominant hand while inserting the tube with your dominant hand into the patient's oral cavity. That's wonderful suction. Next, insert the suction tube into the back of the patient's throat, but do not insert the suction tube farther back than you are able to see. Pull back the pump, trigger handle in a squeezing motion, and hold the squeeze for a few seconds to allow suctioning action to draw in the fluids. Notice how whisper quiet the device is compared to the meat grinding sound of an electric suction machine. Release and repeat. The pump is uniquely designed to prevent backflow to the patient and leaking inside the unit. It is also equipped with an overflow protection mechanism which will engage, locking the trigger handle once the collection jar is full, so you can't overfill. In the event that the pump handle locks and the collection canister is not full, it may mean there is an obstruction in the tubing or in the device. If there is a visible obstruction, replace the new tubing. And when this happens, gently tap the canister on a table. This should clear the obstruction inside the device. In the event the obstruction does not clear, replace with a new jar. And it's as easy as that. When it comes time to clean the device, use a wipe or with disinfectant, but never submerge the pump in water or other liquids. Just wipe it with a dry cloth and a disinfectant. If you do make a mistake and submerge the pump in a liquid, you should replace the pump. The pump and attachments are 100% disposable. It's designed for disposal after each use. Dispose in a manner that ensures body substance isolation and according to your organization's biohazard disposal protocol. Every field nurse should have a RespRelief suction pump in their basic car stock. 100% of patients in the home setting will then have 24/7 access to a suction device directly from the nurse's car stock as their need arises at EOL processes. EOL meaning, of course, end of life. With this device, you are field nurse ready. So there you have it. Call us. We'd love to talk with you and answer any questions you might have. Thank you from Palliative Pros.